As we all know that we all are gathered here to celebrate the International Nurses Week. This week is celebrated in the remembrance of Florence Nightingale. Florence Nightingale is the pioneer and founder of modern nursing profession. Her rise in nursing popularity was especially due to their innovative work during the Crimean War in 1854. To celebrate this week, our faculty organized activities included poster competition and essay writing competition on 11th of May, blood donation camp on 12th May, Rangoli making competition on 14th May.
I think the madam, Nightingale madam, we all celebrate her birthday. But I say it is not only the birthday, it is a festival for me. Because whatever we are, standing here, sitting there, because of the path she has shown to us. This is the day that we not only remember her birthday, but we should remember the path she has shown, the vision she has taken for the nursing. So this concept is not only for this year. I think it should go years long together, and we always remember this concept that the nurses' enforcement, the nurses' identity, the nurses' achievements, we must remember throughout the day and night if we are a nurse truly. So I feel great honor to be here and addressing my own community. Okay, and now we will proceed with whatever I have prepared for today's, and automatically you will set your mind that nurse is not only to provide the medicine and to take personal hygiene. It is beyond that. It is not only skill that you are performing some cooking work or something. It is required skill. But what is scientific skill? But whatever you are doing, you are performing, you are doing procedure, that is also scientifically proved. What if you are giving medicine, what the action the medicine will have, and what you are supposed to observe after giving medicine. So it is scientifically proved. Your activities are scientifically proved. Then responsibility and humanity. It is not only that you discharge your duty. Okay, you got the job, and you are doing your 8-hour job and you go home. But you have certain responsibility. Whatever you are doing on the patients, whether the patients are responding, not responding, what is the position of today and tomorrow, and you take responsibility. Whatever you do, it is your responsibility to see what you are doing and what is your further action. And you are accountable for this. You need also strong bond. You need bond with your profession, bound with the people, bound with the relative of the people, bound with the society. So you will be identified. You have to take as a whole, not only the patient, but their relatives, their even the visitors coming to the patient, and your co-workers, the other professional working with you like physiotherapists, doctors, and all. And make the rapport. Rapport means how you are communicating with the people. IPR system, I think nurses are all known. How to maintain the IPR. So it depends either how to maintain, how to approach and start your interpersonal relationship with all of the person who was crossing with the nursing personality. And the sense of devotion. Nowadays, I am not afraid, I don't afraid to say that this point is little bit lacking because there is the the भौतिक चीजों का बड़ा हो गया है लोगों को, ठीक है? He is wearing this, why should not I wear this? He is having this, why should not I have this? So little bit devotion towards nursing is declining, I think. Okay, this point we have to take up strongly and towards society. Okay, If you do for the society, then society will identify you. You may go and achieve degrees, master's, PhD, MPhil. If you don't discharge your duties and responsibility, so your degrees will keep only with you. Okay, the society will not come to know what you are. What is the role of nursing? I think every nurse has taught about this. What is the role of nurse? But other people also see that what is the role of a nurse. Not only providing basic care, but more than this. Whenever we providing care, we keep all these hearts in my heart. Okay. So, nurse is a teacher. We are teacher to the subordinates. We are teacher to the newcomers. We are teacher to each other. If you achieve one degree, so below to you is all, you are teacher for all. Okay. Then advocate, she has to fight for their right. At the same time, it is not that you are professionally free to proceed, do some procedure, and somebody try to gulf you and try to dominate you, that you can't do. Okay, few procedure, we have procedure book, and we are independently performing this procedure. We don't require any other professional to watch us other than your senior. Then educator, that is the same. We are educating each other. Okay, when faculty are teaching to the students, and you are making production of nursing category. So then we are researcher. Okay, researcher, it is not that you are doing BSc and you are researching something. You are doing MSc, you are researching something. But day-to-day research. Day-to-day research. It is not that you need some degree to research it. But you can find then one post-operative patient is coming to you in your unit, and you have 3 beds. So why the infection is having on the same bed, not the other bed? This is your research. Okay, and this infection, your successful of surgery depend upon your level of infection, on the control of infection. So small research can be done. Okay, if you are giving antibiotic to one patient and he is not improving, or he is not improving, so you can discuss with your doctor that you are giving itne din se medicine. He need further blood investigation why the medicine, and doctor sometimes advise and forget how many days has happened getting this antibiotic. So it is the nurse who remind the doctor that since 4 days he is getting this antibiotic or this medicine and not responding for this. This is your also research. So small research. Okay. Okay, manager, we have all level of nursing personnel, like we have ward in charges, we have above this, we have assistant nursing superintendent with supervisory post, and she is supervising and maintaining her unit. Then we have deputy nursing superintendents who are having above 5 to 6 ANS. There is a deputy nursing superintendent, and there is a channel of communication, channel of command. Then we have nursing superintendent, then we have chief nursing officer, and then we are directly under the medical superintendent. Other than no other category falls in between. Then the Minister of Health, then the Director General of Health, and the Minister of Health. So we have our own parallel system. Okay, we have own channel of command, and the day will come when our ministry secretariat will be separate for nurses. This concept will make the change. If you remember this concept and go along with this concept definitely going to be changed in our system. Definitely we are changing as it that I told. Then collaborator, that you have collaborated with me, you called me from long way, that you come and express yourself in front of this. And we collaborate with corporate, so many, like day before yesterday on 11th we had a meeting. The all great nursing leaders were there in the Indian Habitat Center to discuss the same matter, the same topic. We have discussed, the INC people were there, and the nursing TNI people were there, and the corporate people from Max Hospital and other hospitals were there. So we had a debate on this. If you like to change, everywhere in your curriculum it is written assisting, assisting, assisting. So why the nurse is only assisting? When we have our BSc nursing, so College of Nursing are coming up in production of hardly many, few school are there who are protecting general nursing. Other than they have master's degree, they have MPhil, PhD, and even after master and PhD, they are performing basic nursing. Hardly anybody gets chance to go to the College of Nursing. Okay. So this is demotivation to the nursing profession. If we get chance, we get remuneration according to our qualification, that not only 10 but 100 people will become ahead to achieve this upgrading themselves. Coordination, of course, in working this profession, we have to coordinate each other, like corporate sector, government sector, and other sector. We should talk and discuss about each other to upgrade the nursing profession. Leader, of course, leadership can be in anybody. It is since staff to the high level, anybody can leader. When asked who is ready to work with me in service education program, automatically few names come and I had to select which is the best one. Okay. Leadership. We are growing a caring culture. That is, again, it is communication, how we can grow. If we include all these concepts, then only we can grow. We can grow, I already said that we can grow myself, but I can't grow society. I can grow my nursing community. It can be grow only if I communicate to the people, my compassion, how I am taking it positive to correlate with other, to upgrade other. So it is my compassion towards my profession. Then presence, your presence. It is not that you are some people are identifying you and you make mistake, you make excuses, this is not this, that. So you should be present in all your, mentally, physically, and your all energy should be there when you are doing this leadership and you are talking for the nursing profession. You need skill, not only the present, but skill. How you pick up the things and how you take these things to implement in your day-to-day activities. Competency. This is most important. You go and hysterically, you go and performing the activities, but lack of competency. So your output will be not what is expected. So what is the need of today? We know the patient, we can give care to the patient, all the things we are doing, we are taking patient as a whole. But for further, what it is the topic, further what we need, what we are crying for. So the today's need is to nursing education versus international trend. Why our so many nurses are going and performing abroad, but if one foreigner come, nurse, automatically even medical faculty stand up for that nurse. Why it is not for the nurse, Indian nursing? Only our people do respect, but why not other people? When these people can stand for the foreigner nurse, why not for the Indian nurse? And internationally, their other thing is that we are only doing general nursing, then master in all totality, then MPhil in all totality, but we don't have separate branches like master in secretary, master in A from the beginning. After doing general nursing, and even I don't think that the general nursing is required. Like physiotherapists, they are taking up, Ayurveda is taking up. Why not from the graduation level starts the specialty? So they are taking up this issue. Nursing profession seeks start and sustain. Okay, we are already in profession, but we need a start in a whole, as a whole, and we have to sustain. How we can sustain? We are not sustained by acquiring qualification and discussing each other. But sustenance is when we go according to the requirement, according to the need, according to our identity. We are seeking for the identity. So how we can sustain? We can sustain with our competency, with our professional, professional willingness and upgradation of sir. The nursing profession seeks the socio-economic issues and challenges in nursing. Somebody says, okay, they are not able to do other thing, so they come in nursing. This is the concept in the society, but it is not that. Most of the students who are from the BSc side, from the science cadre, they go first appear for the MBBS. Okay, if 2-3 marks they don't get MBBS, then they come for the BSc nursing. I know so many people. Okay, so it is not less than MBBS. Okay, and the other challenges are there. Nowadays, it is not that nursing are coming from the middle class or lower middle class. The great people are also seeking for this thing. And the personals, one foreigner was on the hospital visit. She said, which caste is coming for the nursing? I said, all 200 castes coming for the nursing. Okay. So it is not that a particular community, a particular region is coming. Now even Brahmins, even Rajputs, even all people are approaching nursing. So we have already gained the status, but we need to restate this status, resilience status. This is the concept on which we had a debate. Okay. The one corporate nursing was saying that we should inculcate with the medical audit. The medical audit go along with the nursing audit. I objected. In private sector you can do this, but in government sector it is simply not possible. When during odd hours a nurse is looking after 50 to 60 patients, it is not possible for her to record all the things, what she is doing, how she is standing, how she is approaching to the patient. Ratio is 1:6 and she is performing for 1:60. So how accountability you can set? Okay, I agreed. If there is a certain criteria, certain norms to be set for the nurses, then only you can include in the medical profession. You provide all the facilities which is written in SIU norms or INC or DNC, any norms. In return, you provide all the facilities, then you can include nurses with the medical audit. Otherwise, we are with them. Otherwise, we are doing all the things along with them. We are sometimes, if something happen with the patient, of course, nursing records are checked, and the responsibility is definitely set, as we have the time for RTIs, time for consumer act, consumer law is there. So accountability is there, but we have our own system of accountability. So challenge is this. What is the challenge behind nursing? Challenge is this. These all things are coming up. The corporate, the manufacturers approach to the higher authority, and higher authority immediately agreed to implement all these things. But where we stand, hardly anybody thinks that okay, nurse should be trained. They purchase ventilator, force nursing sister to Indian ventilator, and just introduce to the nurse. Now you operate it. Okay, so we need certain training to face with this. Okay, we have electronic medical record. It is just initiated in the OPD block that all the registration will be through electronics and centralized register through computers. Then soon we are going to start online appointment with the doctor, online registration. Okay? It is a new concept which is coming up in the government institution also. AIMS mein it has already been started. Now Safdurjung mein is going to be started. Infusion technologies in your setup, I don't know, private institution may immediately implement this because they don't have control. They have their own system. But government may you have long of chain to availability. They make the availability of the things. Infusion may we have so earlier when I was staff, I used to use a syringe, glass syringe with a steel needle. Okay, and I used to check whether it is blunt on the spirit swab, whether it is blunt or still it is working. Okay, so nowadays everything is disposable, and not only one type of syringe, but we have 10 type of syringe, auto-disable syringe, and then we have the already syringe with medicine, the total 1 dose syringe, 2 dose syringe. So many things are coming up. So one has to take the responsibility, and one has to train themselves to face these all new challenges. And we have infusion pumps are there, might be using in your institution also. Then equipments that I told you, all ventilators, baby care units and all are coming up. And also social media. They do not afraid to point out anybody. Okay. And social media like WhatsApps are there, the patient and nurse communication. Okay. This also will be starting. Then whatever queries the patient will have, they can have the number of the nursing who was treating him, and they can clarify their queries. If he need it, then he can call to the consultation with doctor. Like foreign it is already happening. That I told you, new images and diagnosis. Even I don't aware what is happening, because I am in the administration side. I get opportunity to go and see personally, visualize personally what is happening in my institution. How many imaging machines are there, and how they perform, and what is the patient's preparation. And so everything has to be the person who is working in the area. Then only, otherwise they stand simply and the other category is go and shouting on them only. So if one should know that what is the patient preparation and what care he or she is supposed to do after the investigation, so we must well aware of this. Laboratory also, so many investigations are coming. One doctor prescribe me, you go for this. I am unaware what he is written. Okay. If I sit, I am planning to sit 1 hour in the OPD block. So I will come to know what is happening today. In office, I don't aware. People are reporting to me, my DNSs are daily reporting, but they are not reporting all these things, what is happening. If some doctor approach me, he need nurse, that he have started this. Then only I come to know that this is happening. New age ventilator, app software. Now they are planning to have the software that in each ward, like the corporate of the hospitals like AIMS में तो नहीं अभी, like Gangaram, Tirathram, and this क्या नाम है Mulchand, they all are having computer in the nursing station, and everything is done on the computer. If they need medicine, day-to-day medicine is coming from the medical store with the name of the patient. As soon as doctor takes round, he prescribe medicine, nurse immediately enter the medicine to the medical store, and his person come to and deliver the medicine. So this system soon going to be implemented in government hospital also. Robotic surgeries, so many surgeries are coming up, laser surgery, robotic surgeries. So nurse has to take education, to be trained herself for these surgeries. Automatically, we are not going to, there are no such institution who call nurse and teach all these things. But whenever doctor goes, they also learn. And then you assist to them, then only you will come to know about what is the nurse's role in these equipments. Of course, OT tables, now remote tables are there, operating through remotes, beds are there, operated by remotes. So, whatever is availability is there, we have to train ourselves to deal with these challenges. Then at the end, this is the topic, a force for change. After speaking all this, the nurses need to acknowledge their personal responsibility and initiate change. We are here. We have to take initiative to change. Okay, like so many, that meeting they have called so many people, then I offer myself, okay, I will be part of this debate, this panel discussion. Okay, so this way we have guts and we have we make ourselves to talk, to come in front. Thus, to have engaged with research that I told you in a models with contribution, evidence and effective nursing, care and informed healthcare policy. What it does mean? Informed healthcare policy. Whatever we are doing, we are keeping with us. We are not even this the communication system little bit is less because she is always busy dealing with the patient. I may say for the government institution, always busy with the patient, always caring of superiors, afraid from superiors. Okay, because APR जो है वो senior के हाथ में है. So she afraid to express herself. So being a leader, we should give opportunity to the subordinates that he or she can speak her views, her ideas, and what problem she or he is facing. Not only the professional but personal. If the body-mind health, connection is there. If the person is healthy, mentally and physically, and he is the khalipan, okay, nothing is mind and bothering him, then only he or she can give his or her 100% to the profession. Thank you for all patient listening.
What equipment we have to understand that which comes under prenatal?
The lady with the recently we have a set we are facing this problem, prenatal problems. So the maternity HOD approached me that the sister that the patient are dying. So I told that I am with you. Whatever you like to do, you do. I will do what I can do for you. So she approached for 15-bedded HDU only for the maternity patient. It may be prenatal, it may be postnatal. Prenatal has so many problems like PET is there and other patients with the pregnancy with medical terminology, medical problems. So we have set a 15-bedded ICU inaugurated by DG, and it is well set. No other patient is admitted in that ICU. So the result is poor, and I am happy to say that the HOD is saying that nurses are performing more than my expectations there, and most of them are general nursing. We have given 2-3 days training for how to operate ventilator, how to operate this infusion pump and computer and whatever is set, and they are well trained. They are giving their 200%, and everybody is happy. The message has gone to the DG also. So they are planning to have a more such kind of HDUs.
Even photograph also?
Photograph also.
And one more thing.
We have, we have photogram, and one new thing is also coming. That is Daksh. Daksh is also coming. That's it. Direct kangaroo care. It is a new concept. So we have set up one room for this, and we have already started that.
One more thing. Robotic simulator surgery means for
It
the
is
learners.
a new concept. It is not yet implemented in the. It has not come, but it will come. Private institution may have like robotic heart surgery, robotic.
Robotic surgeries are there, but in between one word is there, that is simulator. That
Simulator means you have set as something the model,
yeah,
and you train people on them.
Yeah.
Then we are ready to
prepare themselves to
So
perform
what
an
are
actual.
the equipment is needed for
The
the
simulator
robotic
in
surgery?
our Dux clinic जो है उसमें we have simulator. Then patient go on the next stage. Then you will do this. They have simulator.
On behalf of SGT University, entire fraternity of nursing, extend you a hearty vote of thanks for gracing this function and sharing your valuable thoughts, which ignited our mind to grow both personally as well as professionally. Thank you, ma'am.